Okay. Good evening, everyone. We will call our meeting to order, and I will do the invocation. Heavenly Father, we glorify and magnify your name. We thank you for this wonderful day. We ask for your guidance as we go through our agenda. We ask these in your name. Amen. Okay, thank you all for being in our meeting today. I do have Chris, Dr. Hagler, Dr. Pons, myself, and Mark Spitzer at the present time that are on, and I need a motion to adopt the agenda.
So moved.
Okay, is that Chris?
Yeah.
Okay, and may I get a second?
Yes, it's Dan, second.
Thank you very much, Dan. All right, and the motion has been second, so again, all in favor, I will go down the list. Chris Bowe, please.
Aye.
Dr. Hagler?
Aye.
Dr. Pons?
Yes.
And Mark Spitzer?
Yes.
And myself, James Mack. Thank you very much. All right, may I get a motion to accept the minutes from the meeting from January 19, 2021?
Mr. Mack, this is
So
Laura.
moved. Mark.
Hey,
Okay,
Mr.
Mark
Mack,
was
this is
the
Laura.
person, and Laura is the second?
Yes, and Steve
Okay.
Morris is on the call now too. Steve Morris is on the call now too.
All right, thank you very much. All right, so we got Mark as a first on the motion to accept the minutes. Did I get a second?
Yes, that was me, Laura.
All right, okay, I wanted to make sure I didn't know if that was a different comment. Okay, all in favor, Chris?
Aye.
And Dr. Hagler?
Aye.
Dr. Pons?
Yes.
Mark Spitzer? Okay, I didn't get a comment from Steve, and I didn't get a comment from Mark.
I think he said aye.
Okay.
Yeah, this is Steve.
Okay, and Mark Spitzer?
Sounds like we may have lost Steve.
Okay. Myself, would make 5, so again, we're good to go as far as the motion to carry. All right, we will go on and start with the reports, and the first reports up will be Sue Yates.
Hey, good evening, board members. I have the 3 monthly reports that I am sharing with you. The financial summary report looks at where we are at the end of January. At the end of January, we are looking like we are in pretty good shape. We're doing a good job keeping our revenues and expenses in, and to date, we do have funding for our COVID activities. So we also have our snapshot report, which we still have a red for dental as we work to continue to align our revenues and expenses. An additional dentist was hired in January. However, we've had another dental resignation in January. So we are evaluating to see whether or not we'll need to hire another dentist at this time and the support staff. And the variance year to date looks at January 2021 to January 2020. The 2 years look very different as COVID happened right about this time, and starting in March. We are hoping to hear from the state in the month of February regarding additional funding for our COVID efforts in the vaccine clinics, as those clinics we are doing about 3 times a week. Does the board have any questions about the financial reports?
All there's no questions, we will move to our next agenda item. And I think that will be you, Dr. Ford.
Yes, good evening, everyone. I'm going to give you my director's report, just summarizing some of the main accomplishments of this past month by the department. It's been an incredibly busy month, once again in January, largely because of our ramping up of COVID vaccine response, yet many of the departments continue to do very successful work in other areas. Really happy to say that in human resources, we have posted the equity coordinator position and are conducting interviews for that. Hopefully you'll all remember that we have highlighted equity as one of our main focus areas for this year and through the next couple of years as we work to align all of our programming, both internally and externally, with equity metrics. Around our finance department and grants, we have a very robust grants program. We submitted grants for over 200,000 in the month of January. We'll be submitting 3 more grants on Monday, with a total of 7 in development valued at about nearly $1 million. So always staying up on ways to build our diversified funding streams. One of the grants we're looking at is a community health worker model, specifically for the COVID response. We think it's really important for CHA, in order to address equity, that we start to build a strong community health worker program where we have folks who are from the community, out working in communities, boots on the ground, really developing those strong relationships with some of our most vulnerable populations, and a community health worker model is an excellent way to accomplish that. In our IT department, I really want to take a minute or two and praise this group of 5. Ryan McGee, our leader, and Kevin Shanison and Sherry and Brandy and Patrick, small team of 5, but they have been working practically round the clock on quite a number of projects as we ramp COVID up and then just keeping general operations running. They have just in the past month worked on a standalone vaccine scheduling solution so that we could get patients scheduled when we realized on January 6th that a walk-in, drive-in, I guess you could say, clinic was not going to probably be the best model. They got that up and running quickly. At the same time, they started working with our CureMD process and system to get scheduling to go through that so that it would be even more efficient, give us better data, and relieve a lot of extra work on the team. And they've also been building social determinants of health screenings into our electronic health record for our clinical areas, which is one of the Medicaid transformation metrics that we will all be measured on. So they have just really been innovative and doing great work, and they're even out there supporting all the COVID vaccine clinics too. So they've been working hard, as is our whole department, really. In clinical services, women's health, pediatrics, and our communicable disease clinic staff have all been participating in the COVID vaccine clinics. Kudos to Julia Patterson, who has done a really nice job of redoing the schedules so that we can get staff out there 1 day a week to help with the vaccine clinics while still maintaining our number of appointments here in the clinic so that we're not reducing service for our patients who are getting their care services here at CHA. So great work on that. And our Sun Clinic has 17 clients enrolled. That's our substance use network program for our maternal health program. We've had 3 clients of those 17 who were referred in from our peer support specialist in our syringe exchange program. So really wonderful to see our outreach efforts there resulting in women getting into treatment services that they so strongly need. Our dental program was able to obtain an extension from the Duke Endowment for our school-based dental project. That program has been put on hold as a result of COVID and schools being in a virtual only situation. So we have gotten extension so that we can continue to provide that service once the schools are back up and running. They're also working very hard on getting value-based metrics in place, and while at the same time struggling with staffing limitations. In general, public health dental programs across the state are noticing that folks are leaving dental service right now, because of the extra strain and safety concerns over COVID. And we're also experiencing that, but still trying to keep service up and running for our patients. Our school health program, again, another program that deserves lots and lots of praise and kudos for the extra efforts they've been putting into COVID. The school nurses have been helping in all areas of the COVID response over the past month or two as the schools had gone virtual, while also working very closely with the schools on case investigation and contact tracing strategies, and also working on the Cabarrus County School Board Task Force to make recommendations and look at data and helping the schools to determine when it will be safe to return to more in-person models. I think the model of us working with the school districts under Chip's leadership at Kannapolis and with Superintendent Louder's leadership in Cabarrus County has been truly a model for others to emulate, and is, I believe, a reason why we're seeing so little spread of COVID in the schools, because of the tremendous work that both the schools, our school nurses, and our whole COVID team is doing to assure that we are keeping kids and education professionals protected. Our school nurses rolled out the rapid antigen testing program over the past couple of weeks, so that again, we can immediately test any students arriving who are having symptoms, and then offering and extending those services to family members as a way of finding cases quickly, getting them isolated and contacts quarantined, so that we can prevent the spread of any COVID cases in the schools. COVID response teams, another area that just has been doing top-notch work and deserves so much credit for maintaining just extensive loads in case investigation and contact tracing. And our call center is experiencing volumes that we have never before experienced, with hundreds of calls coming in a day, and with people requesting vaccine appointments and that. And the team has just been hustling to create resource options to maintain top quality service there. We started our vaccine clinics in January. They have become well-oiled machines. I can tell you, the volume of thank you notes we are getting through email, through personal calls, is just extensive and incredible. We even have patients who've gotten vaccines coming back and bringing snacks and treats and fruit baskets and that to thank all of our staff and volunteers, and that has really been appreciated by folks who are working such extensive hours. One thing that has been a concern for us is that we have not gotten the additional funds down that the state has committed and said that we would receive to cover our vaccine clinics. Now we just learned today on a call with the state that we should be hearing more about the amount we will be getting by the end of next week. And that's going to be critical for us to continue to maintain the ramped up operations that we are trying to do with 3 clinics a week, vaccinating thousands of county residents. Our Cabarrus Public Health Interest Initiative has been very active in identifying opportunities for funders, and we're planning on meeting with some of those funders over the next few months to educate them about the good work we're doing and hopefully strike up partnerships with them. I'll be reaching out to some of you to join us for some of those meetings. You may remember that one of our main fundraisers for the CPHI is the golf tournament, which unfortunately got canceled last year. We have set the date for 2021. Hopefully that will come off, and that date is October 11th. If y'all want to mark your calendars for joining us on that day. In our healthy living programs, you'll remember that we have created a position to focus specifically on that by expanding some of Alicia McDaniel's responsibilities, and we are working on a number of lifestyle medicine efforts there. We have a lifestyle medicine program in partnership with the Free Care Clinic, and they're getting some great statistics from that program, with 91% of the participants successfully managing their hemoglobin A1Cs, which is individuals who have diabetes, through using lifestyle medicine practices. And we're also starting up a culinary innovations program, which is called Taste Your Way Around the World. Our chef, Mark Allison, will be holding virtual cooking classes, focusing on a different country each month. So we're excited about that. In environmental health, we have 2 food and lodging positions that we are currently interviewing for, and we are working on a request that we'll talk about a little bit more in a few minutes to expand our on-site positions by 1, because we're getting so many more requests right now that the volume has really increased, and we are struggling to keep up and stay with a rapid response time, which is critical for our county as it undergoes additional development. Our Healthy Cabarrus, our Healthy Communities work, that we've been trying to keep that still going strong in the middle of all the work we're doing around COVID. Marcella Beam's been doing an excellent job of keeping both balls in the air, if you will, with both COVID and the Healthy Communities work. We had a mental health action planning retreat on at the end of January, and all the committees are meeting within the next month or so for the 3 priority areas that we have this year, which, just as a reminder, are mental health, housing, and then early childhood education efforts. We've got an extension on submitting the community needs assessment report as a result of all of the time and effort being put into the COVID pandemic, and we will be getting that submitted by June 1st. Marcella will be joining us over the next couple of months to give an update there. In our substance use work, which is one of our priorities for the last cycle, in terms of trying to address policy work, there is a policy at the that we are working with some of the providers in our clinics related to promoting non-opioid strategies in the prevention of pain as a strategy to try to prevent addiction. We as an agency strongly support programs that are pushing for non-opioid approaches. And so we've been working with our providers to have them review some of these policies and let us know if these make sense for us to support. So we're working on that project right now. In our performance improvement and quality improvement areas, we are developing trainings for our staff so that they all become more comfortable with report cards and data entry, since that's another one of our priority areas. Our scorecards are getting updated, and Betty Foe's been doing a great job of getting them posted live on our website. You see in the report that we have 6 report cards that are now live on the website. I encourage you all to go in and take a look at them. We were working with our medical leadership team to get these developed and posted, and so we're excited to be starting to roll out those report cards, those data metrics, as live data sets for our community in general to be able to look at to see the work we're doing. With our Board of Health activities, I want to take a minute and thank some of the Board of Health members who have been volunteering at our COVID vaccine clinics. Mr. Mack has volunteered several days, and he's brought Mrs. Mack along too, so thanks for that. Mr. Spitzer's been there expertly directing traffic for us. Thanks, Mark. And Dr. Pons has been there every time she's got her week off from hospital service. She's out there at least 2 days volunteering her time working in the clinic. So huge thank you to our board members who have gotten actively engaged helping us with these clinics. We're approaching to where about, anywhere from 40 to 50% of the folks working at the clinics are volunteers, both volunteer providers and volunteer community members, which shows such strong support from our community to help make sure we reach our goal of vaccinating 80% of the community. Mr. Kincaid, special thanks to him for sponsoring a lunch. We try to provide lunch for all our staff and volunteers, and we'll show you a slide a little bit later in our COVID update, where we have had, again, tremendous support from the community in making sure that our vaccine folks, workers, are getting a good lunch every day while they're volunteering. Just a couple of national, state, or local updates. You may have noticed that Governor Cooper and Dr. Cohen have recently come out very strongly recommending that school districts start to return to some degree of in-person learning. They shared quite a bit of data. I'll present that in a few minutes as part of our update that shows that it is safe for students to return to schools. And so they have, at the state level, been strongly encouraging schools to consider this. I shared with you all that the NALBOA conference is in August in Grand Rapids, Michigan. I had a question or two back from some of you regarding whether that will be virtual or in person. I checked with them, and as of now, they are hoping to hold an in-person conference, but it may change depending on what happens with the COVID pandemic. So I'll keep you all posted on that. I think it'll be a great opportunity for one or two of our board members to attend that conference, to engage with and learn from other board members from other areas. And so I am hoping that some of you will continue to be interested in that. I don't have this on the written report, but I do want to bring it up. I shared it with you all yesterday that the North Carolina Association of Local Health Departments is advocating to increase funding to local health departments for communicable disease efforts. This COVID pandemic has clearly shown that local health departments are severely underfunded in which then limits their ability to respond to pandemics such as this. And there is legislation that is going to be introduced, and we want to be able to educate our legislators about how much work that we are doing here at Cabarrus Health Alliance, and how important assuring that local health departments are prepared to fight these pandemics is. So I'll keep you updated on that as that evolves also. So that's my report for this month, and I will answer any questions if you have them regarding any of the information I shared.
Bonnie, this is Mark. If my memory serves me well, early on, about a year ago, there was discussion of a report at the national level that had been put together for dealing with pandemic type outbreaks that had been pushed aside and put on a back shelf somewhere, that at the time was touted as being something that could have helped us. And when I say us, the entire nation. Mm-hmm. My question, my recollection of that causes me to ask the question about whether there has been conversation at the state level for putting together a statewide emergency plan based on the experience of COVID that could then be utilized in the event that we hit something similar in the future, that would go to particularly some of the areas where it seems that the state may not have been as prepared, and or the coordination between state and federal governments may not have been as good as possible, and remains potentially the case at this point in terms of the delivery and clarity about vaccines being where they need to be for clinics that are being held. So I hope that was an intelligent question, or an intelligible one at least. Is there anything that you see that the state is looking at that would create such a report based on the lessons learned from this year?
I think that's an excellent suggestion, Mark. I can say that from the meetings that I have been participating in weekly with the state, I have not heard the state say something like that. I will pause for a second and allow any of the staff on the call, because staff attend various and different meetings with the state on a regular basis. So if they're aware of anything, can anyone jump in and share if they've heard of anything like that?
Good evening, everyone. This is Erin. Before COVID, our state did have an emergency preparedness network, and so they are certainly adding to their existing resources, lessons learned from COVID, so that in the future, if we have COVID-like pandemics, these things are certainly documented. So I think at the state level, they are trying to create a playbook so we don't lose all the lessons learned.
I'll be sure to ask that question directly at some of my North Carolina Association of Local Health Director meetings and the meetings with the state, so to continue to encourage and prompt them to think about that. Thanks, Mark. Any other questions?
Okay, I guess your COVID
I
update.
think we're moving on to the COVID update. Nope.
Oh, yeah, you have the COVID update.
I believe
Erin?
Erin is going to share her screen, so I'm going to unshare mine and allow Erin to share hers.
All right, can someone give me a yes if they see that?
Yeah.
Yes.
All right, that was a good yes too. Everybody's awake tonight. All right, Dr. Coyle, you just let me know when you want me to advance the slide.
Go ahead. Yeah, Erin and I will tag team here to share some of the update for you all on our COVID efforts. So go ahead and advance. So I'm going to start out with some of the data, and then Erin will take over with a little more data, and then I'll finish up with just some summary items. So we are up to 17,000 cases in Cabarrus County since we started this pandemic last March. The vast majority of them are the PCR positive cases, and about 1,500 are the antigen positive cases or rapid tests. So the lighter blue bar is the PCR test, and then the darker blue bars that you see are when rapid tests started to be introduced and used. So the good news is, what you'll see here is that while we have been on, we have not had good news for quite a number of months, as the number of cases was just on a steady and uphill climb. You'll see that we peaked out, a little hard to tell on this one, but somewhere around January 9th, with the most cases in that past week. And now we have seen for the past 3+ weeks a decline in the number of cases. So that is the promising news, and that hopefully that trend will continue. The introduction of the concern over variant strains is certainly causing us to all feel a little cautious, but the fact that we're seeing this downward trend now for a good 3 weeks in a row is very promising that we're starting to get things back under control. Oh, go ahead. This slide is showing you, similar to the previous slide, how many cases came in 1 week. And again, there you'll see where the week of January 9th, we had about 1,400 cases, and since then, we've been seeing a steady decline of a little more, around 200 to 300 case decline each week, and up through the past 3 weeks. When you look at the different ages there, the teal colored bars are our school-age children, if you will, that 0 to 17 age group. And you'll see that that was the highest on January 9th, dropped a little, but has been holding steady. Whereas most of the other groups, age groups, if you look at, you'll see significant drops in the number of cases in the age groups. Certainly the red bar, you'll see quite a reduction there, which is our 25 to 49s, a pretty substantial decline in the number of 18 to 24-year-olds, but also a decline in the 65 and older, and hopefully as we're getting vaccinations into that particular group, we'll continue to see that nice decline in the number of folks testing positive within that age group. Go ahead, Mary. This slide shows school age groups broken out a little bit more, showing the blue line is those children 5 to 17 years old, and then the 18 and older, which could be college age students, is in the orangish red line. And so while the number of 0 to 17-year-old has been holding steady, you'll see that we are seeing a decline in specifically the 5 to 17-year-old age group, which again further supports the low level of infections in that population and the ability to do some in-person learning safely. Okay.
All right, so this is a slide you have been accustomed to seeing, and those of you who join us for Monday morning leader calls know we talk about our percent positive. So these are the number of tests completed that have come back as positive. And so our last report was 10.3%. And so, we want to be back in single digits. The other important thing to note on this slide is the green bars note the number of tests still being done in our community. And we're really pleased to see that that remains relatively high with, almost 6,700 tests completed in this last week's report. This data is pulled from a weekly state report that we receive. And so it is highly anticipated every Wednesday. A bit of good news, though, is that on the state dashboard, the state actually keeps a rolling average for percent positive. So every day you could go, and actually multiple times a day, you can go and actually see this if you hover over Cabarrus County on the report, and it shows you a percent positive. So when I updated the slide earlier today, it was actually at 9.7, which was very exciting to see. Cautiously optimistic that the report we will see tomorrow will be back in single digits. And so that is good news. Of course, we really want to keep driving that percent positive down towards that 5% mark. That would really be where we feel most comfortable. In terms of daily hospitalizations, a bit of good news on this front as well. We're seeing our hospitalizations track downwards. So we did hit a low yesterday at 71, and we did have a bit of a bump today. But overall, again, seeing that decline. Our hospital partners on our call yesterday were able to share that, they are feeling that load lessen, but I'm sure Dr. Hagler and Dr. Pons could also elaborate on that. But in all good news, we want to make sure our hospital capacity stays at a place where they can take care of all people who need care and not just COVID patients. So a little bit about vaccines. We've been living the vaccine world now for what feels like years, but it's actually only been a couple of weeks. And so this too is on the North Carolina Department of Health and Human Services website. They have done a really nice job with this dashboard, I will say. Some good lessons learned early on from testing that they really got this dashboard up pretty quickly for vaccine administration. So here you can see for Cabarrus County, we are in the darkest shaded tier. So that means that we've given over 15,700 vaccines in Cabarrus County. So if you hover, it's Mark, if you will mute, oh, yep, there we go, we're good. So if you hover over our county, you'll see that total doses administered is just shy of 22,000. And frankly, with the clinic we did today out at the arena, we have eclipsed that number. But first doses is 16,300, second doses 5,667. So for the percentage of 7.53 and 2.62. Important to note that the state is using our full county population for those percentages. And so that would include individuals 0 to 15. 0 to 15 in that age range are actually not eligible for the vaccine at this point in time. So I'm going to show you what we are looking at internally that helps us. But before I do that, I also want to show you what else the state is providing, which is a great dashboard to really help us target our efforts. So this is first doses administered by demographics. This is specific for Cabarrus County. So you can see by race, our white population close to 83%. So we've got some work to do with our minority populations and making sure that we are reaching them. And so we actually worked with our HM partners today to talk about, how do we use our shared resources to do that. So we are going to be taking the lead and working with El Puente and our Hispanic Free Clinic. HM is going to be taking the lead and working with our African American churches. We're going to regroup in 2 weeks, and we're going to see what sort of impact we made, and then make a plan from there. You can see here by ages, groups 1 and 2 are obviously we're targeting our 65 and older, and so our percentages here are showing just that. So in terms of our age groups being reached, that's good. But we do have more vaccines in our female population than male, and some of that might be because our healthcare population and our nurses are primarily women. So in terms of our internal dashboard, on the left here, you'll see what CHA has been responsible for administering, and then on the right, that's the full county. So internally, CHA has done 12,441 vaccines. This doesn't include our clinic for today, so it's already outdated. So first doses, 9,000, second doses, almost 3,500. And so that's 5.6% of the population, and then 2.1% of the population. And this population is adjusted for those who are eligible. So 16 and up. Pfizer can actually be given at 16 years old and up, and then Moderna 18. On the right, this is Cabarrus County as a whole, but we've adjusted those percentages based off of eligible population. So 10%. We've set a goal that we want to vaccinate 80% of Cabarrus County. And so we're going to continue to update this dashboard so that we can see that progress and work towards that goal as well. And I know we're going to talk about, we had a chance to meet with Congressman Richard Hudson today. And so we're going to be sharing this dashboard with Congressman Hudson and his staff on a weekly basis as well. So just a quick review, we're in groups 1 and 2. If individuals would like an appointment, those are available on our website. But if they go to our website and an appointment is not available, then they can join our wait list. Our wait list is a great communication strategy we're using to, number 1, call people if we have extra doses at the end of a clinic day, or 2, when we're getting ready to open appointments for first doses, we're able to reach out to them with a text or a call and say, have you been able to get your vaccine yet? And if it's a no, hey, we're going to open up the appointment portal. So please be looking for it at this time. Because we got a lot of feedback from individuals saying, I always miss it. I log on 2 hours too late and then they're full. And so this is a good way that we've also been able to make sure that, our Cabarrus community members are aware of what's going on. What we've also done, though, is we've captured a couple of key questions in our waitlist survey, patient's workplace, but also if they are education staff members. So that way, once we are given the green light to move forward, we really want to prioritize our education staff members and take care of them. We know that they are eager to be vaccinated, and we are eager to serve them. And so we feel like we've got a really good way to reach out and communicate with them. And thanks again to our IT team in getting those resources set up and working really, really well for us.
And so, as I said earlier, there's been quite a number of relatively new research articles that have been published that are showing that the school environment is really quite safe, especially when mitigation strategies are practiced, like wearing masks, social distancing, and washing hands. And so again, as I mentioned, that the governor and our Secretary of Health has come out saying that that we really want to get kids back in school because of all of the other consequences that happen when kids aren't in an in-person learning environment. But then, as Aaron said, education staff are considered group 3 for vaccine priorities. So as of right now, they are still not in the group that can be vaccinated. Yet again, research is showing that this environment is safe. And so we've shared this information at the Board of Education meeting last night, acknowledging some of these studies and recognizing that if proper mitigation strategies can be maintained, that there does not appear to be transmission within school settings. And so that is something we want to start thinking about as a community. Go ahead, Aaron. This is just some additional information that the state has shared with us and asked us to continue to support and share with our communities around the safety of in-person learning, that school systems that were very strongly enforcing use of face masks had very, very low rates of transmission, but there was actually lower rates of transmission in the schools than in the community in general. And that when you do see students becoming infected, that it appears to be more related to out-of-school activities like sports or other social gatherings. So at the national level, the CDC is recommending that in returning to in-person learning models, that all efforts be made to maintain that 6 feet of social distancing. We are still also recommending that. There also is some indication that 3 feet may be safe, but feel like we still need to see more data and information about that. So again, you know, the main point or the main thing to share with you tonight is that we do appear to be moving in the right direction, which is something that has not happened for a few months in our reports to you. The new cases per week, you can see over the past 4 weekly measures have continued to drop. However, that 746 cases per week averages out to a rate still of 782 per 100,000 population over a 14-day period, which is still nearly twice what we want to see, that level, before we feel like we've got the community spread under control. As Aaron shared with you, our percent positive rate was at 9.9 yesterday, and it sounds like when she looked today, it was even lower at 9.7. We'll get the official week result tomorrow, which is what we normally are tracking and trending, and we're feeling pretty positive that it's going to be below 10%, which really is a milestone for us to get below 10% for the first time in quite some time. Hospitalizations are at only moderate and medium impact, which is also good news, and we are up to, if you use just our eligible population, we have 10% of our county residents now vaccinated, many of them in that 65 and older age group, which is the age group most likely to have severe illness or death from COVID. Okay. So if you'll recall our metric that our chart that both the state had put out and that we have also been using to decide sort of the activities we should be recommending depending on what zone we're in. We are technically quite likely now going to be in the orange zone tomorrow, which will be the first time we've been out of red in quite a number of weeks, as our percent positive drops below 10 and the hospital impact has dropped to medium. We would still have the number of cases per 100,000 at the rate that would keep us still in the red zone, but with 2 of those 3 metrics in the orange zone, we would then reclassify as orange, which is good news that we're getting out of that very severe community spread. So based on the new research that has come out related to safety in school settings, we have revised this graph to suggest that in both the yellow and green zone that schools could consider Plan A, B, or C, that in the orange zone, Plan B or C is something that could be considered. Plan A can be, at least there can be discussion about Plan A if that social distancing could be maintained, which will be very difficult for many schools because Plan A means all kids are back in school at the same time, and most schools will really struggle with the social distancing component in that model. And that when in the red zone, either a Plan B or C would be a feasible option, depending on the current trends and the direction that things seem to be going. I just want to mention a couple of things here. Aaron mentioned that Congressman Hudson was here today. He wanted to see vaccine operations. He was very helpful in addressing some of the issues that we had over the past month with vaccines, and is just very supportive. And gave us some helpful hints today about places we might be able to find some additional funding. And so we're happy to be working with him to be able to vaccinate as many of our community as possible and as soon as possible, and as soon as the vaccine numbers will allow. And I just can't say enough how heartwarming it is to see the community support that we have experienced as we attempt to vaccinate the whole county. On this slide, you see all of the physicians and the advanced practitioners who have volunteered their time, absolutely flat out volunteering their time, coming out to the clinics to help us do medical evaluations, to help us administer vaccines. And I just think that that's phenomenal. In the picture, you'll see Dr. Pons and Dr. Woolner, who have recorded the most hours of volunteering yet of all of our providers. But huge thank you to all the providers for the number of hours that they're putting in here. And there you see our own Mr. Spitzer, as he has been out several times to volunteer at the clinics too. And not only are we having providers and other dispensers volunteering their time and community volunteers, we have 400 community volunteers that are helping with all different aspects, but our community has also stepped up in a really profound way to help donate lunches for our volunteers and our staff, as I mentioned previously. And so I just wanted to take a minute to list all of the agencies who have made a donation to cover lunch, and to acknowledge the food vendors who have given us marked discounts in the cost of the food so that we can stretch the funding dollars and continue to offer a delicious lunch to all of our volunteers. So again, as you see from looking at this, our municipalities, the county, many agencies, both nonprofits and for-profit, have been getting behind this effort. Today, we had Eric Key from the Brick House Grill actually came out to serve up the chili that they gave us quite a deal on today, because he wanted to say thank you to everybody who's working in this effort. So again, tremendous community support for all of our efforts, and it's really amazing to see. And this is just some additional folks who have been donating water and drinks and snacks to to the effort. So you can see, again, the amount of community support just continues to grow. Excuse me. And thanks to Diane Berry for her efforts at coordinating all of this and making those requests. Diane has really done a phenomenal job of reaching out to the community and securing these donations. Okay, do we have any questions about the COVID update?
Bonnie, this is Mark. The only thing that, I mean, you guys are doing a fabulous effort. I would encourage all the board members to go out and volunteer at the Cabarrus Arena. It's a heartwarming thing to do. I've done it a couple times on Friday, and it's a great way to end the week and start the weekend. Uplifting.
Yeah.
The one question that I had, and the one concern that I saw in the presentation, and it's not just here in Cabarrus, it's throughout the country in the statistics that I'm seeing, is that our communities of color, our communities of that we're most concerned about, that are being hit hardest by this, are underrepresented in the number of vaccines. And given our equity commitment, I'm just wondering what we as a board can do, if anything, and what you guys are doing to help to quell the fears that may be out there, which are, I think, legitimate in many cases, but also to encourage folks to get fine and get vaccinated. So I think, you know, whatever extent we have mechanisms that we can use, I think we need your guidance, and we need to act in a concerted way to enrich our minority communities to get these vaccines. So I'll leave it to you. I just want to know what we can do to help.
Yeah, that is something that we have been consciously checking for the past few weeks. You know, how are we doing at reaching minority populations, since they are in many ways facing the significant burden from the pandemic. I'm going to let Erin jump in there. Erin's been spearheading a number of special efforts to reach this population, as we realize that we have some work to do in that area, and she's been pulling committees together, and I think we have a pretty solid plan for how we're really going to reach that population.
Yeah, absolutely. So we actually have begun meeting and pulling together partners with El Puente. So many of you are familiar with El Puente Hispano. So we are going to have a soft launch of a clinic at El Puente next week. And so Dr. Pons actually is connecting us with some of her residents who are bilingual and excited about community outreach. And so really my goal is to have a staffing model out there where everyone is bilingual. And so that it is truly an inclusive and a welcoming environment. So Sandra Torres, who's a CHA staff, but also an El Puente member, is instrumental in that. We're also going to be reaching out to the Forest Hills Latino Free Clinic as well. As I mentioned earlier, we met with our Atrium partners, and so they are going, while we are targeting our Latino population, they are going to, over the next couple of weeks, be working with our African American churches. And so they already have a really strong developed relationships. Of course, we have our parish nurse program as well. And so you will see whether it's a drive-through clinic or their mobile vaccination bus, you will see that in the Kannapolis area over the next couple of weeks. So that meeting was at 3:30 this afternoon, so you're getting it hot off the press. And so our goal is to divide and conquer, and then we're going to come back together. Additionally, our federally qualified health center is also a newly approved vaccine provider, and so they began giving vaccines last week. And what's important to know is that, you know, these are uninsured individuals, and they do have a large minority population as well. And so we are all rowing in the same direction. We're all focusing on those same things. And then lastly, we are helping one of our DaVita dialysis in Cabarrus County. They have multiple locations. They are an approved vaccine provider, but they just have not been able to get an allocation from the state. So we're actually going to be working to transfer vaccine to them this week, because not only do they have chronically ill individuals who need the vaccine, but they also have a high minority population that they serve. And so a lot of people, like I said, again, really coming together to make sure that we aren't missing any segment of the population. I'll add one more thing, because I know I'm talking a lot here. We're working with our community paramedic program for our homebound individuals. So if someone they physically cannot get into any vehicle, whether it's a city bus or a Department of Human Services van, they cannot. Our community paramedic program is going to be serving those individuals. They were out today for training, and so we'll have a soft launch of that program on Friday. And then we're working with all of our transportation providers in town to bring individuals who they can physically get into a car or a bus or a van. They just don't have access to that. So they are also going to be doing a soft launch and bringing those individuals to our clinic on Friday. So a lot of different initiatives to make sure that everybody in Cabarrus County who's eligible has access to a vaccine.
Okay. Any other questions for Aaron or for Dr. Cole on the COVID update? Okay, if not, we'll move to our next agenda item, which would be Suzanne Knight on the reports area clinical service strategic plan scorecards.
If I could just jump in quickly while Sue is pulling up the slides. As you will all recall, one of our main goals this year is to get dashboards and report cards up for all of our program areas, and so we're bringing each program area to you through the board meetings each month. So Suzanne has done a tremendous job with the mammoth responsibility of getting all the clinical areas up, and her team has worked with her for both the strategic plans and the report cards. So take it away, Suzanne.
Hello, my name's Suzanne Knight. I know most of you. I'm the clinical director, and I'm going to share my screen. Let's see. And hopefully, let's see. Can you see that yet?
Not yet, Suzanne.
Okay. Okay, screen one. Okay, now?
Yes, ma'am.
Okay, thank you. Okay, from the beginning. So for the clinic department, our strategic plan includes all of women's health, basically everything that's on the second floor, and that is the women's health department, the pediatric department, communicable diseases, and medical records, essentially everything that supports all of the clinics. And so obviously I don't do all of this work myself. I have tons of people who add into that. And so with me tonight is Julia Patterson, who's the assistant clinical director, and Marcus Meisenheimer, the communicable disease nurse manager. Melissa Blosky, who is the medical records supervisor, is not here, but she also had a big part in the strategic plan. So with our first strategic direction, using data to improve health, we focused on goals 1 and 2. And we have scorecards for all of our areas: pediatrics and women's health, medical records, and communicable disease. All of our scorecards are live. I think we talked about that. Someone talked about that earlier in the board meeting. And the links to those are included in your board packet. You can get to those from our webpage, and all of the data on them is being updated constantly. We work on those. You know, we're really a work in progress, and we're working on those all of the time. The next goal, goal 2, by fiscal year 2022, medical records will ensure that 75% of patient charts will include complete demographic information. While medical records collects demographic information now while they register patients, they really wanted to dig down and get into a lot more demographic information that would tell them a lot more information. And so they want to get into more, be able to collect more statistical information within our EMR, and that's what they're looking at being able to do. So that's what this is about, and they're working with IT to be able to get the information that they need to be able to pull that out of our EHR system. The next strategic direction: develop internal and external practices for programs and policies that achieve equity. Using the information that they're able to obtain from the goal before, medical records will also take that information and then ensure that equitable access to care is achieved. So that what they're going to do is take the top demographic, the top the information, and find the top if the languages are Hispanic and Arabic, for example, then they want to make sure that all of our information is available in Spanish and Arabic. So that's the kind of information that they want to be able to pull out of the EHR. Along the same lines, with the same strategic direction, by fiscal year 2022, the Substance Use Network, the Sun Clinic, will continue to provide exceptional maternal health services for women who use substances. And this is our clinic within the maternal health high-risk clinic. Bonnie spoke about this earlier as well, and we just have integrated this into the high-risk clinic, but we really want to hone down and really reach some goals within that clinic, and come to and really, reach some other, pull out some detailed information from that, and that's what this is about.
All right. Good evening. I'm Julia Patterson, and the clinical services will reach the strategic direction of building and sustaining collaborative systems through addressing social determinants of health through goal 3 and 4. Goal 4 looks at the alignment and integration of public health programs to address social determinants of health. Clinical services has incorporated a social determinants of health screening tool within each of our clinical areas, which include pediatrics, women's health, and communicable disease. We will use these screening tools at different times in different intervals throughout their visits while they're in clinical services. Then goal 3 looks at expanding and maximizing community partnerships to effectively address those social determinants of health. And CHA has partnered with NC Care 360 to use their referral platform to address the needs that are identified through our social determinants of health screening tool. So we will be referring within our community for those social determinants of health through NC Care 360.
So transforming agency capacity, culture, and practices to achieve excellence is the next strategic direction. And by fiscal year, the end of fiscal year 2021, our family planning clinic will improve access by increasing the percentage of patients who receive same-day choice of contraception. We've already completed Upstream USA training within our family planning clinic, which integrates the methodology into our family planning clinic. And we're working with IT to facilitate all of our CHA EHR data to IMAT, which is a third-party vendor. And within the next year, we're going to have ongoing ongoing upstream training, coaching, and operationalizing the practices to keep this going.
Okay, our fourth goal is to expand CHA's capacity to include alternative service delivery and outreach models that improve access to care. By fiscal year 2024, we plan to conclude our preliminary research of underserved areas to be served by mobile access. This will be done by determining how to run reports based on zip codes and determining the most needed services such as well child visits, immunizations, and STD screenings and exams. We're going to utilize the GIS heat map to assist in determining underserved areas of the community or those lacking access to care.
And by fiscal year 2023, we would like to propose an expansion of the Sun Clinic to provide additional relevant services moving into the postpartum period by researching additional services provided by UNC Horizons and researching best methods to expand these services in the postpartum period. And lastly, again, transforming agency capacity, culture, practice, and practices to achieve excellence.
By fiscal year 2022, we'd like to acquire a community health worker. And we plan to do this by researching funding opportunities to ensure that we can sustain the position. And we're going to continue to collect STI rates and input those rates into the GIS software and compare state statistics to inform our outreach.
By fiscal year 2024, we intend to reestablish our centering pregnancy program to improve the disparity gap in the infant mortality rate within Cabarrus County. We plan to We plan to survey patient and client interest, do the program development, explore training facilitators using integrating a community health worker, integrating the FCC programs, and integrating lifestyle medicine, which would be a whole new dimension to this. And that is the end of the clinical services strategic plan. Now, I need to unshare my screen. Unshare my screen.
Are there any questions for Suzanne?
Yes, any questions?
Okay, if not, we'll move on to the next agenda item, which will be the Family Care Coordination Strategic Plan and Scorecards, and that will be Megan Chu.
I'm sorry, I couldn't hear that.
The FCC Strategic Plan, Megan?
Megan?
Hello. I'm Megan Shuping with our Family Care Coordination Department. You can go to the next slide for me, Sue. For Strategic Direction 1, our use of data to improve health, we are focusing on goals 1 and 2. For goal number 1, creating a public-facing data repository, we, just like everybody else, is working on that scorecard, and ours, like mentioned before, is currently live. So you can visit the website and look at our scorecard. We will try to update that data monthly. We've got some that are monthly and quarterly. Next slide. For goal number 2, using an equity lens for data collection, analysis, and dissemination, FCC will develop a real-time demographic reporting. This first category is around our pregnancy and our early childhood care management. We have 2 care management programs that focus on women who are currently pregnant and families who have kids 0 to 5. We're also going to work on improving our demographic tracking tool with our PPP program, which is a evidence-based parenting program that really empowers and trains our current workforce in the county. So giving them an extra tool in their toolbox to provide parenting programs for birth to teen years. So we're looking at improving that data collection to provide some more demographic information. We're also looking at improving the demographic collection for our Project More program, which is an adolescent parenting program. And this program, the adolescent parenting program, works with parenting or pregnant teens currently, providing them with parenting education, as well as ensuring that they do graduate from school. Just wanted to give you a little bit of background about some of our programs. So for the next strategic direction, we are focusing on goals 1 and 2. So developing internal and external practices and policies to achieve equity. For goal number 1, ensuring equitable access to services, we are going to work on and currently working on providing all of our materials in a bicultural and bilingual for mostly, we have some materials in Spanish right now that we're working on translating, some required documents for our care management programs and getting those translated to Spanish. We're also working on, by fiscal year 2025, ensuring that 90% of our care management cases with immigration status issues receive wraparound services. And this is everywhere from specialty services, making sure our materials and everything is provided to them, those resources needed, and also recruitment tools, and if we can identify any additional funding to be able to help provide these families with additional services. Next slide. Around goal number 2, transforming our workplace to be more inclusive and equitable for employees. So FCC is planning and has been working on developing processes to ensure that we have hired and we have bilingual, bicultural staff, but also making sure that those staff are assigned to all of our referrals that we receive. So maintaining those staff. For our next strategic direction around goal number 3, FCC is looking at fully utilizing the NC Care 360 platform to make referrals, track our successes, and assess if there's any needed resources in the community. We do have our care management staff up and going and trained in this program or this tool platform. So we're already starting to kind of identify if there are some resources out there that are needed and working on what we can do for our patients. For the next strategic direction around goal number 4, FCC is looking at expanding CHA's capacity to include alternative services delivery and outreach models to improve access to care. We're focusing on our Project More program and incorporating at least 2 supplemental grants to ensure that funding and that we have capacity for our Hispanic population. We are looking at collaborating more with our pregnancy care management program, looking at those increased referrals. A lot of these referrals normally come from our school health department, but since teens and our high school kids haven't been in school as much, looking at partnering a little bit closer with our pregnancy care management program and ensuring that these parents, these teen parents, have the knowledge that they need and working on the developmental child development issues with their children. So that is the FCC strategic plan.
Any questions? Okay, thank you very much, Megan. And we will move into our consent agenda area, and we will ask Suye if she will come up for the budget revision.
Yes, next on your agenda is the budget revisions for the month of February. The revisions mainly include things to align budgets with actuals after getting 7 months into the year, realizing how COVID's going to affect each department, each grant. We were able to do some alignments. We did receive some additional funds from the state for the COVID response. So that is the majority. Does the board have any questions regarding the budget revisions?
Okay, hearing no questions, could I get a motion to accept the budget revisions?
So
Can I get a
moved.
motion?
So moved, that's Mark.
Okay, was that Mark?
Yes.
Okay, may I get a second?
Second, this is Kim.
Okay, and we have a second. All in favor, going down our list would be Chris Bowe.
Aye.
Dr. Hagler.
Aye.
Dr. Pons.
Aye.
Steve Morris.
Aye.
Mark Spencer.
Aye.
And myself. Thank you very much,
Dr. Baylor, too.
Dr. Dale. Okay, thank
Aye.
you. All right. Thank you very much. Okay, our next agenda item will be the business agenda, and we will start off with the CHA strategic plan, and that would be Betty for.
Good evening, everyone. I bring to you the final portion of our strategic plan. There have been some updates, especially in our industry analysis section, where we have changed competitors to collaborators and partners and made sure that we talked about us being a convener of partners to address some of our public health needs. I am just asking for approval so this can be our 2020 to 2025 strategic plan.
Okay, are there any
Go ahead, Mr. Mack.
Were there any questions in reference to the information that was in the plan? Okay, hearing none, may I get a motion to approve the 2025 strategic plan?
Mr. Chairman, you have that motion.
Okay, thank you very much. That was Chris. And may I get a second?
Second, this is Mark.
Mark, thank you very much, Mark. Going down the list, Chris Bowe, all in favor?
Aye.
Okay, Dr. Taylor.
Aye.
Dr. Hagler.
Aye.
Dr. Pons.
Aye.
Steve Morris.
Aye.
Mark Spencer.
Aye.
Myself. All right, motion carries. Thank you very much. Our next item will be the Personnel policy revisions, and that would be Dr. Steve Cathcart, please.
Just before Steve jumps in, Betty, could you send out a clean copy of that with all the revisions accepted so that we can have that on file? I think
Yes,
we're on.
yes, I can. I can send that.
Thank you.
Dr. Cathcart on deck.
All right, thank you. Yes, I'm here. So Sue's driving for me. So the personnel policy, the personnel policy change, the major highlights. So the rationales for changing these things in the policy was to support equity, promote a sense of caring for employees, help boost employee morale, and streamline some processes and procedures. So one of the major things we changed with the personnel policy is to put more gender neutral language. About 90% of our employees are female, yet the majority of the pronouns and the descriptive language were for men. So like, for instance, his supervisor or employee should turn in his thus and such instead of her or something more gender neutral. And so that's ongoing work. That I tried to catch everything, but that will be ongoing work. Another issue surrounding equity. So this is meant to replace the Bring Your Child to Work policy. It mirrors. It's going to be paid parental leave. So eligible CHA employees will receive 3 weeks of paid leave, and it runs concurrent with FMLA. So it's not in addition to FMLA. FMLA is standardly, it's 12 weeks. So you won't get 15 weeks. You'll still get 12 weeks. We're just funding 3 weeks of that. I think this is very necessary for equity. For one of the main reasons is that very few people can even take a part in Bring Your Child to Work. So for instance, if you're a nurse, you cannot bring your child to work. If you work in the dental clinic, you cannot bring your child to work. And also I think it's more fair gender-based policy where it's parental leave and not focused strictly on maternity. The next is progressive discipline. All I did was streamline the process. I removed the pre-disciplinary conference because once you get to the pre-disciplinary conference, the decision has already been made. So I don't see a reason for an extra step in there. And then, again, it's a streamlined 4-step process: verbal warning, written warning, probation, and termination. Of course, there is more detail around that in the actual policy, but that's the basic streamlined 4-step process for progressive discipline. And then the bereavement policy, I updated that. Currently, we can only use sick time for bereavement for the death of a family member. I kept most of the same language for the current bereavement policy, just changed the piece that said you get 5 days of paid bereavement leave for the death for an immediate family member. You can use vacation or sick time for a non-immediate family member, but we thought it really showed more heart to give employees some paid bereavement time, especially for immediate family members. Also, that helped eliminate some equity issues where some supervisors may interpret the policy different than others, and yes, I think they may be able to approve or deny bereavement time. This way, you don't have to worry about that. You get your 5 initial days, and truthfully, for death of some immediate family members, you're going to need more time. So we are going to encourage supervisors at all levels to work with employees with the death of an immediate family member, but we thought it was important to give those initial 5 days paid and not have to use your any of your accruals. And those were the major highlights. Does anybody have any questions? So, and I have turned in the policy with the strike-throughs. I also sent out a clean copy. I'm having a little trouble formatting the entire policy. It is a long policy. But I also did attach a Excel spreadsheet that shows the highlights of what the former policy was and what the current policy was. There were no real major changes, and the ones that I really wanted to show the board were the ones I put in the PowerPoint, because those had some additional time for employees attached to them.
Okay, are there any questions for Dr. Cathcart on the policy revisions?
Steve, these look really good to me. Have you rolled them out to the employees at this point? If so, what kind of reaction are you getting? And if you haven't, what are your plans for doing that?
I did show these to the leadership at the leadership team meeting and to all the supervisors at the CHA supervisor meeting last week. Of course, I did let them know it was subject to board approval, and very positive, very positive response to all of the policies. Employees seemed especially excited and grateful about the bereavement policy and the paternity leave.
That's great. Thank you.
You're welcome.
Any other questions before we put it to a motion? Okay. May I have a motion to accept the policy revisions? Everybody speak at once.
This is Dan, so moved.
All right, thank you, Dan. May I get a second on the policy revisions?
I'll second that.
Okay, thank you, Chris. All in favor, reading down our list, Chris Bowe?
Aye.
Dr. Taylor?
Aye.
Dr. Hagler?
Aye.
Dr. Pons?
Aye.
Steve Morris?
Aye.
Mark Spitzer?
Aye.
Myself, thank you very much. All right, we also have Dr. Cathcart on the policy review and revision. So again, we'll let you go up again.
So these two, there are two policies that have to come up for board approval and signature every year: the whistleblowers policy and what's the conflict of interest policy. Previously, these were housed in finance. We've moved them over to HR. There are no changes to the policy at this time. I would just say they will be added to the code of conduct and the personnel policy. And that's where most of these types of policies go. They go in the employee code of conduct. So it's whistleblowers, conflict of interest. We're just changing where it's housed, so no change in the language or procedures.
Okay. Any questions on the moving the policies over? Okay, if not, may I get a motion to accept the review and the revisions of those policies?
Motion.
Okay, that was Dr. Pons. And may I get a second?
Second, Mark.
Mark, thank you, Mark. All in favor, Chris Bowe?
Aye.
Dr. Taylor? Dr. Taylor? Dr. Hagler?
Aye.
Okay, thank you very much, Dr. Taylor and Dr. Hagler. Dr. Pons?
Aye.
Steve Morris?
Aye.
Mark Spitzer?
Aye.
Thank you very much. Motion carries. Our next agenda item will be the strategic budget items for fiscal year 2022, and that will be Sue Yates and Dr. Cole.
Yes, we have been working on our budget request, what we think it's important large dollar items to move forward into FY22 as a leadership team and with our departments. We wanted to bring those to you tonight. We will share our first request with the county. I believe it's February 15th with county staff for direction and discussion before we move to the work sessions and to make sure you guys see these again. So, Dr. Coyle, would you like to go through them?
Sure. So again, as Sue mentioned, we wanted to just bring these to your attention as larger cost items that we think are very critical to our functioning during fiscal year 22. And one is, and I mentioned this earlier, in our environmental health program, we realized that we are short-staffed on folks for our on-site programs. And in fact, as we surveyed some of the other local health departments to see how much staff they have and how many inspections and site visits they do, we are the lowest staffed and do a large number of site visits and calls and things. And so we feel that in order to keep up and not have long waits, that we're going to need to add one more position, and are putting together the budget, the justification for that. In our human resources department, Dr. Cathcart has been doing a tremendous job at identifying how we can get our system updated in general, and he is recommending, and the leadership team agrees, that we need a more effective learning management system that can track leadership training and development and all kinds of employee tracking kinds of information that now currently gets done manually, which is incredibly time intensive. And so that system that he has identified would be about $22,000, and we feel that that will really help us with our efficiencies. Our syringe exchange program, which came out of our last Healthy Communities Community Health Needs Assessment cycle, needs some additional funding to help cover the supplies for the programs that are not covered by grants or state dollars, and that would be about $10,000 total. In our school health program, we feel we are trying to advance the focus in school health to be very population health focused, so that we can develop better outcomes that really demonstrate what we are accomplishing. So the two areas that would require some additional funding are around the school health director position, which is overseeing the entire program, including more population-based programs, and then a new electronic medical records system that will allow much better tracking of metrics and outcomes. We're hoping to approach some funders to help with the electronic medical record system that will really help us do a better job of, again, looking at the health of all of our students and developing the metrics that will show that we are improving their health. And then lastly, the epidemiology position. You'll recall that we actually brought that position on this year and have been using COVID dollars largely to fund it. The COVID pandemic has shown even more so how important having epidemiologic function within health departments is, and we want to be able to continue that even as we go past the pandemic. So those are some of the main areas that we are going to be looking to identify new funds to carry forward. And again, as Sue mentioned, we're still prepping our budget, and that we'll be bringing the more detailed versions to you, but we wanted to at least get some of these initial important programs out there in terms of the requests that we would be making. Are there any questions about those?
Dr. Coyle, this is Chris. Just an observation really, but the school health director, I'm surprised that we didn't have that position already. That's a net new position.
We have done some restructuring in the program this year. So we have that position structured in this year, and we were able to move funds around to keep it funded. It's not that we didn't have the position, we've just reorganized the program in general to bring some of the grant funded programs that we have that are very school-based into partnering with the school nurse program. So we've just simply made a more comprehensive department. And so yes, there's been a position, we've just changed the job description and what they were overseeing.
And then the new electronic medical records, will there be an annual service fee that's capitalized on top of that, or is that the net?
They will be. So that the initial purchase there would be $84,000, and then I believe the annual fee would be Sue, is it 30,000 or something like that?
Yes, it's in the $30,000 range for the annual fee. So that the 84.4 is the initial fee to set up in the first year, and then after that there will be an ongoing fee. We definitely are going to let the county know that we're working with some community foundations and some other organizations to see if we can get the initial purchase of it covered, and that would not be something the county would have to do. But as of today, we don't have a firm commitment, and we do think it's important to move the school health program forward next year. So we will include that, and then certainly if we find a different funder, that dollar amount would be reduced.
Any other questions? Okay, if not, thank you very much, Dr. Coyle and Sue. The next agenda item would be announcements, and I only have a couple. One would be just a reminder for our next board meeting, which will be March the 9th, 2021. And also just to basically say, again, kudos and thank you to the CHA team and all that they are doing. I had the opportunity, as Mark and Dr. Pons had also indicated, to go out to the clinic and work with the team and just to see the job that they are doing and actually physically hear some of the comments from the individuals that are coming through the clinics. So they're doing an excellent job, and we just want to just continue to commend them for the work that they are doing there. But at this time, I have no other information that we need to cover, so I would need a motion to adjourn the meeting.
This is Dan, so moved.
All right, thank you very much, Dr. Hagler. And may I get a second?
Second, this is Mark.
All right, thank you, Mark, very much. All in favor? I know you want to go home. Chris Bowe?
Aye.
Dr. Hagler?
Aye.
Dr. Daylor?
Aye.
Dr. Pons?
Yes.
D. Morris? Mark Spitzer?
Yes.
And myself. Thank you guys very much, and we will see you next month if we don't see you before. So you guys be safe.